Good morning.
Good morning,
Good morning. All right, I must be in the right place. All the finest people are here. And of course, I'm here with the heads that know things about health policy. And yes, health policy is very sexy. And we're going to talk about it today.
Really? You're going to talk sexy at 8:30 on
Well,
Saturday
sex and
morning?
health go together, right?
That's true, yes.
Let's get right to it. We were introduced. Obama didn't care. Look, health care is a mess, and we can fix it. The Trump administration is ready to do it. And let's talk a little bit today about how the rest of the world freeloads on American innovation. Steve, talk about those freeloaders.
Well, hello, everybody. Great to be here. Don't you love 2.0, Trump? It's even better than Trump 1.0. And what an honor it is that the four of us get to be Donald Trump's warm-up act.
Yes,
so that's
right.
fantastic.
And Javier Milei's.
Yes, there you go. So I'm very, very qualified to talk about the economy and healthcare. I worked at McDonald's for 1 year, so I'm very qualified. I'm here to tell you a couple quick things. Number one, I just turned 65, and I will not join AARP. It's an evil organization. They're too liberal. I call it American Association for Ripping Off Old People, and we should get out of that. Number two, we need more...
Phil, you're not old.
We need more healthcare transparency in this country so people know what they're paying for, and hospitals are telling us what it's going to cost, and patients are telling us when they go to the hospital or when they buy drugs or when they go to see a physician. You know, no one knows what these things cost, so we have a market that needs to be fixed. And finally, and then I'll turn it over to the rest of you, you are so right, Jerry. We lead the world in drug innovation. 18 of the last 20 wonder drugs in America came from American pharmaceutical companies. And what's happening is the rest of the world is ripping us off. They're stealing our intellectual property. They're not paying their fair share. And we have to make sure we can bring drug prices down in the United States if these other countries paid their fair share. So let's do it.
And let me interject on this, Steve. One of the things we need to fix that was a holdover, you know, we talk about the importance of intellectual property rights in terms of our innovation. One of the things that had, God forbid, had Kamala Harris been elected was, remember, she had pledged in 2019 to seize the patents of drug companies and pharmaceuticals in the name of price controls. And in 2023, the Biden administration tried to do just that by changing the rules by which we innovate and award intellectual property. That's one of the first things that the Trump administration needs to do, is to pledge to protect intellectual property and protect this thing called the Bayh-Dole Act.
Phil, price controls. It's not just the foreign countries, Europe, compulsory licensing threatening our innovative companies. It's also right here, the ridiculous named Inflation Reduction Act.
Yeah.
It didn't, you know, it's like a Saturday Night Live skit. Yeah. It didn't reduce inflation, but it did all kinds of mischief. It raided Medicare, but it also introduced price controls that is hurting American innovation.
Yeah, is anyone here seeing less inflation because of Inflation Reduction Act? Did you see your prices go down, paying less for drugs and groceries? Everything worked just like Biden said. We call it the Inflation Acceleration Act. This is one of the most absurd, misnamed laws. And
see ahead for knowing things.
What they did that was so outrageous is they put these price controls on prescription drugs. And price controls are always a bad idea, because when you put a price control on something, you create shortages. You get less of what you're price controlling. Everyone who lived through the 70s knows what happened. We put price controls on gasoline, you had long lines. You put price controls on medicines, you don't necessarily have shortages of the ones that already exist, but you get fewer new ones.
Right.
You don't get new ones developed if there's a price control on them. And the craziest thing about Inflation Reduction Act is they used price controls to reduce the amount that Medicare spends on prescription drugs by over $200 billion. But they didn't use that money to shore up Medicare. They didn't use that money to send it to seniors in the form of rebates or lower prices or lower premiums. They used that money for giveaways to wind and solar guys and electric vehicles, all this unrelated left-wing spending, and so
hold on
that
for a
bill is
second.
completely outrageous. Let me just finish my...
All right, go ahead.
And inside the price controls, this is even the craziest part, inside the price controls, they have more draconian price controls on pills than they have on injections.
Yep.
So they actually created an incentive within it for every new drug that is developed now is going to be an injection, because injections have a 13-year protection from price controls. Pills only have 9.
There you go.
Now, every person I know would rather take a pill than stick themselves with a needle. So this is one of the dumbest political things ever. So I'm hoping that Republicans, they should repeal every word of the Inflation Reduction Act, in my opinion. Do people agree with that, every single word?
Yes.
We should repeal every single spending bill that Joe Biden passed, and just save $5 trillion by getting rid of every one of them. IRA, what was the Build Back Better, all of these things. Erase them. Get rid of them, Mr. President.
To put a price number...
But if they can't at least get rid of that penalty on pills...
Yeah, we're talking about that. Yeah.
That would be pathetic.
Yes.
That's like the absolute minimum they should.
But to put a price tag on the rating of Medicare, I mean, we're already talking about the issue of Medicare, which is strapped for cash. We can sort of debate that. But to rate Medicare for $250 billion to pay for the Green New Deal, and they admitted it, right? The Inflation Reduction Act was nothing more than the Green New Deal. Something has to be done. I know we're going to talk a little bit about the EPIC Act.
You know,
and what that does.
The funny thing is, during the debacle debate, when Joe Biden, former President Biden, said we killed Medicare, that wasn't a slip. They actually raided Medicare, and again, they have the hubris to accuse others of wanting to raid Medicare. Real quick, guys, talk about the pill penalty. So.
I referred to this a little bit, but the way they wrote these price controls, pills can be subject to price controls after 9 years. Injections can't be subject to them for 13 years. So you have this 4-year difference. So what we're basically telling all the pharmaceutical companies is put your investments into injections, because you're not going to get whacked for price controls.
And there's a fix here, right? There's a fix here.
There's an easy fix. A congressman from North Carolina named Greg Murphy has a bill that just changes the 9 years from pills to 13. So as I said, absolute minimum that they should be able to do is that. I want them to be more ambitious. I'd like to see the whole scheme gone. But absolute minimum is that, because how do Democrats vote against that? Yeah. They're going to go home and tell their voters, no, we want you to have to inject yourself with every new drug that comes out.
So think about this. We have Europe and other parts of the world freeloading on American innovation. We have politicians in the U.S. enacting laws that introduce innovation-killing price controls. We want to bring... Who here thinks they pay the right amount for health care? All right? Yeah. We want to bring the costs down, and there's ways to do that. One thing is PBM reform. Yeah. So all you guys, start here, Andrew, PBM reform.
So let me just gin off of the issue of the price controls and the importation issue.
Go.
Because it is parallel to what we've been asking in terms of foreign policy generally, right? As we're asking other nations in NATO to pay their fair share for, so that America doesn't foot the bill for global security, we need to be doing the same thing with regards to healthcare, especially with the amount of innovation we're doing. Now, the issue of PBMs is an important one, and what's amazing
what's
about
a PBM?
That's a pharmacy benefit manager. It's essentially a middleman between the drug companies and the consumers in terms of setting prices. And it's an area, weirdly enough, in which Democrats and Republicans can agree that something needs to be done, and yet, nothing has been getting done. I know Phil could speak to that issue. We need to get it done now. We've had opportunities.
I grew up in the Bronx and in Irish Italian neighborhoods, and there was always a guy walking around the neighborhood who would go and visit the stores and such. That's the PBM?
Well, the PBMs now are actually all owned by the big insurance companies.
Yes.
So they're not really a separate company. It gets a little bit confusing, but basically, normally, I love middlemen. I'm not one of these middlemen are horrible guys. I think that usually they're market makers. They reduce friction. So I try to be... But
I'm against middlemen.
In this case, it's actually... they exploit a loophole in federal law. They have an exemption from the federal anti-kickback statute. I don't know why or how they got this exemption. But in any other federal program, you couldn't do what they do. And this is what they do in Medicare Part D. When they're negotiating prices, the insurance company's PBM division, when they're negotiating prices with the drug makers, they don't go in and say, hey, we have huge buying power, we have 10,000 pharmacies, we want lower prices on all these drugs. Instead, because if they did that, they'd have to pass on the lower prices because there are caps on the copays. Okay, what they do is they say, we actually want a really high price, and we can base the copay at the counter on that really high price, but then give us a huge rebate, and we can pocket the rebate, because we're exempt from the federal anti-kickback statute that in any other federal spending program would make that illegal. So Trump tried to end this. He actually, in his first term, they did a regulation from HHS that prohibited pocketing those rebates, said any rebate has to be passed on to seniors at the point of sale in Medicare Part D. And in the Inflation Reduction Act, they delayed the effective date of that Trump rule until 2032.
So let me put a fine point on this. Again, an issue in which voters, consumers agree is a bad thing, in which Democrats agree, many Democrats agree is a bad thing, in which President Trump has said is a bad thing. Many Republicans and Congress folks on this stage last year said, this is a bad thing. It hurts average, everyday working families in America. We need to do something about this. And yet the swamp still strikes back and says, no, 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 we're going to delay it down the road. By the way, this gets into the whole issue of transparency.
Let me get to some optimism, because we're more than halfway through the panel. This is why I'm very optimistic on healthcare right now going forward. First of all, I think that Trump learned a lot of lessons in this area in his first term when he was stymied in these different ways. You know, for instance, in USMCA, he actually got Canada and Mexico to agree to pay more for certain classes of drugs, which of course would have been a huge breakthrough if we could replicate that in other trade agreements. Nancy Pelosi insisted that come out. They actually took it out of the agreement. She's not going to have the power to do that. No one's going to have the power to do that when he gets these provisions in trade agreements this time. And his healthcare team is fantastic. It's phenomenal. Yes. It's unbelievable. What do folks think of RFK running HHS? Are we excited? It's going to be unbelievable. How about Marty McCary running FDA? How about Jay Bhattacharya running NIH?
Here.
So we've really got a dream team coming in. Yeah. And I think that he did that incredible healthcare transparency order in his first term, that all the prices for everything in healthcare were supposed to be posted. 75% of hospital systems are in violation. They're just not complying. Well, I mean, when we get Dr. Oz in at CMS, we get this new team in play, they're going to say, hey, you don't comply, you don't get paid. Yeah. And we're going to force them to comply.
Steve,
so I'm really optimistic with the team we have coming in.
Speaking of lessons learned from Trump's first term, and we all want to make America healthy again. That's why RFK Jr. is going to be one of the great HHS secretaries ever. But can we all agree, everyone in this room, that never, never, never again will we let the government shut down our schools. Never again should they shut down our government. Never should they shut down our churches. What they did was so terrible for our health, and we will never let the government do it. It was the greatest abuse of power ever. I want to make one point about the drugs, because this is so important. Folks, we are on the cusp of so many incredible breakthroughs in medicine. It is so exciting. In everyone's, unless you're over the age of 9. By the way, I'm 65. I'm so excited to learn that I'm going to be able to get Social Security for the next 65 years of my life, right? But we can...
65, you're living young. We know 150.
Exactly. So look, we are going to have cures soon for cancer, for epilepsy, for multiple sclerosis, for all of these horrible diseases. The problem, the fundamental problem with these price controls, be very clear about this. When they impose price controls, it delays the introduction of these new drugs that can save lives. So in other words, price controls on drugs kill people, and we got to get rid of them.
You know, I want you guys to comment on this. So other nations have an industry or something that is innate to that nation, and they promote it. America has the greatest innovators in the world in human history, yet many politicians beat up on the innovators. Talk about how there are solutions. Everyone here is probably very frustrated that politicians talk a big game, but there is legislation to fix the PBM problem. There is disruptors in place now with RFK Jr. and the others you mentioned. The fact of the matter is, solutions are real. And what I like is Donald Trump says to his staff every day, how many days left? So there's not much time. Go ahead.
I think that the Republican Party and the conservative movement have suffered from a lack of ambition. And I think that Trump and Elon Musk, people like what Doge is doing. I mean, let them loose on our healthcare bureaucracies. Let them, you know, bring some badly needed efficiencies. I think that, look, people, by and large, voters, not just on the right, but everyone, they hate big pharma, but they also hate big insurance, and they also hate big hospital systems, and they also hate big government.
Yep.
We hate everything involved in healthcare except probably your own doctor. And one of the problems that we have is that everything that's happened in the last 20 years in healthcare has pushed towards bigger, more bureaucracy, more consolidation. You know, we have a situation now in Medicare. This is so crazy. We have a situation in Medicare where if you go to your physician's office and they're an independent physician and they're not part of a hospital system, they have to bill Medicare a lower amount than if you go to the exact same office and they're part of a hospital system.
Right.
And so all the physicians' offices are getting bought up by the hospital systems because we'll pay them more. That is an insane incentive because now they're part of some huge bureaucratized system that is generally inefficient, and they are less able to exercise their own medical judgment. So what I've been telling people, and I think we have the right team in place to do this, is be willing to blow everything up. Be willing to get a real functional market in healthcare that's free of all these bureaucracies, government,
and that's why these disruptors are so important.
And let me,
look, before you say, I want to get to the EPIC Act, because that's the solution, but Langer, go ahead.
Let me just add to this, because it goes beyond, obviously, the pharmaceutical side of it, the drug side of it. But again, if you are changing the way we reimburse doctors for their time, what you're going to do is, like everything else with price controls, you're going to get fewer of them. We should have been, for the last decade, doing whatever we can to produce more medical care, more doctors, more nurses, and more physicians' assistants. We are facing a massive gap between the number of physicians that we have and the number of patients who are going to need them. This is the coming crisis in medical care. We need to be starting today with fixing that.
Another point, and something that Trump did in his first term that's highly underappreciated, and something we have to expand on in his second term, and I think all of you would agree with me. Everyone should have the right to try these drugs. So in other words, if they have a new cancer drug or a new drug for heart disease, right now, you know, the government holds these up by 6 or 7 or 8 or 9 years. And Milton Friedman used to say, you know, this is a perfect example of how regulation kills people. You know, they say, oh, look at how, you know, all these drug approval processes. And you know, they say, oh, there's a new drug that's going to save 50,000 lives a year. If the government, as Milton Friedman would say, if the government holds that up for 3 years, guess what? The government just killed 150,000 people.
Right.
Right? So everybody in this country should have the right to try experimental drugs. How many are with me on that?
Hey, guys, we're getting to the 2-minute warning.
There's another side of that coin, though, which is no mandates ever.
Yes.
It's your decision. No mandates ever.
All right, guys, I think we'd all agree when we follow politics, patience, innovation get hurt. There's no reason why the Republican Party or the conservative movement shouldn't be the party and the movement of science and solutions. But we're short on time. Real quick, one solution, the EPIC Act. Tell me about the EPIC Act.
This is a one-page bill that just fixes that pill penalty that we were talking about earlier.
Very good. I want to say,
it's pretty rare to have a one-page bill. I'd like to see more one-page bills in Congress. This is a one-page bill. It's written by a congressman named Greg Murphy, and it just says the price controls are not stricter anymore for pills than they are for injections.
All right.
That's all it does.
So I have a one-sentence bill that would solve all these problems. Government is the worst medicine.
Hear, hear. Hear, hear.
All right, so wrapping things up in less than a minute. It's like being on the radio and I'm looking at the clock.
Yeah, looking at the clock.
How can we be more pro-science, more pro-patient? The right medicine, the right therapy to the right patient, the right time at the right price?
Well, I think this is the challenge to the new team that's coming in with RFK and Marty McCary and Jay Bhattacharya, and I think we've got a lot of people who have been very committed to science, and you got to do it by, don't tell us, show us.
Yes.
Publish the results, prove it. Don't expect us to take your word for it.
Steve?
I'm going to go back to what I said at the very outset.
No, we're up on a break.
We have a lot of seniors in this room, a lot of people in their 50s. We're going to make a pact today that we're going to get, everybody's going to get out of AARP and we're going to join AMAC, okay? That's the way to solve the problem.
And no more freeloading. No more freeloading from other countries on our innovation.
Hey, we are in a good place in this country. We should be hopeful and understand that innovation in science is on
And how cool is this, by the way, that today you're going to see the two most popular leaders in the world, Javier Milei and Donald J. Trump. I mean, how about that for a
Thank you very much.
Thank you all very much.
Thank you very much.
During my second term, we will fight for Alaska like never before.
I'm excited about what we can do with President Trump in the office.
We'll work together to provide affordable energy to Alaska and allies all over the world.
More investment, more certainty, production, more exploration.
Thank you to everyone in Alaska, and thank you to your great governor. I look forward to a long and enduring future relationship. Drill, baby, drill.